Hello and welcome to this week's video. My name is Natalia Munoz and I'm an occupational therapy student. For today we're going to be talking about developmental milestones for a 2-year-old. So in terms of self-care and dressing, a 2-year-old should be able to take off socks, take off shoes that have been untied already, and then they should be able to pull down pants that are not buttoned. They should be able to already be unbuttoning large buttons. And in the area of gross motor skills, a 2-year-old should be able to kick a ball, start running, going up and down the stairs, holding onto the handrail or your hand, and they should be already climbing up and off furniture. For fine motor skills, a 2-year-old should be able to already stack 8 cubes, up to 10 cubes. They should be able to scribble on paper or using a crayon, a marker, a pencil, and they will use a digital pronate, which is when the tip of your finger is pointing towards the paper and then they can just scribble. They should be able to imitate vertical and horizontal strokes, not long lines, but just little strokes. They should be able to lace large beads and then open and close the lids of bottles. A lot of it is bilateral hand coordination, bilateral integration, being able to use both hands, one to stabilize and then the other one to manipulate. They should be demonstrating a little bit of hand dominance, and that's how you usually know, okay, he or she prefers the right hand or the left hand. Now, if I were to do an assessment on a child that I've never treated before, one of the first things I would try to do is to talk to the treating therapist of the child, and if that's not possible, I would, if I have enough time, I would try to review the documentation, because that's the most accurate information that you would have, given that you can't contact the treating therapist. So daily notes are really good to review. Always look back to the plan of care that is current and it's about to expire, and then have a full occupational profile description provided by the parents or the caregiver, and try to communicate with the other treating therapists of other disciplines so you can have a better picture. Again, sometimes time is not the best, so try to contact the treating therapist and get as much as information, or if not, you're gonna have to base yourself on the documentation. The other question was how can you facilitate, or what strategies can you use with a child that has a speech delay? So in a child that is able to point, because a 2-year-old should be able to point at things in a book, you can use an AAC device, which is nowadays you can use the iPad and you buy a program, and with that you can teach them how to point at pictures and communicate. At 2-year-olds, it's just simple pictures. You can use the PEC system, which is a picture exchange system, and that one is really good because it's simple pictures such as water, swing, or sign language, basic sign language such as more or all done, give me. You can use swing. So those are simple sign languages that you can use with your children in your clinical setting, and always incorporate the parents and try to teach them so everybody's using the same type of communication. And even though occupational therapists are not practicing communication with the AAC or the PEC system or the sign language, it's always good to promote and encourage the child to use it, even in the occupational therapy session, because then you're going to generalize the concept of what they're learning and they're going to be better at communicating. A lot of times children will have meltdowns because of frustration of not being able to express I'm all done, or I want more, or I want to eat. So teaching them how to use simple language, sign language with their hands, or the AAC device, or the picture exchange system is going to promote participation. It's going to decrease the emotional outbursts throughout the session, because they will learn how to communicate their wants and needs. And that was it for this week. I hope you enjoyed the video, and thank you for listening.